Holly Cotton here, and you guys know I love to have a broad range of topics on my show, whether it be financial health, physical health, or mental health. I want to make sure that we cover that triage so that we are all being the healthiest versions of ourselves. So I am super excited about our guest today. I have Dr. Tonia L. Former, and she is an ENT. She's a surgeon. She is out here. She's also an entrepreneur. She has tons and tons of videos about educating people about ENT issues, things that are going on, disparities in minority communities, all of that great stuff. Of course, I had to go stalk her because one of her reels, she actually is really funny too. So she's a boss, she's a doctor, she's fabulous, she's beautiful, and she's funny.
Oh.
Like, what else don't you have, Dr. Farmer? So one of her reels came up on my Instagram page, and I was like, not me about to slide in the DM to find out what Dr. Knows' story is. So, you guys, welcome Dr. Former today. So, thank you for being here today.
Thank you. Thank you for having me. Thank
Of
you. I'm
course.
honored. I'm honored.
Thank you. So, first, I would like to go into it because one, ENTs are always have always been pretty much a male dominated genre of medical
Like
expertise.
most surgical fields. Yes.
Exactly. So I love that not only are you a woman, because I'm all about the women empowerment, but you're also a Black woman, minority here, and you're like killing the game in every aspect, not just the one that's behind the desk, giving
Right.
prescriptions. Like you're out here, you have all kinds of other businesses that you're doing. So first, can you just tell us your story and how you got to be Dr. Nose?
Sure, sure. So my story of getting into ear, nose, and throat really starts when I was 7 years old. And it started with a very tragic time in my life. I had a twin sister. My twin sister, Sonia, was diagnosed with metastatic bone cancer when we were 7 years old. And she battled that bone cancer for 2 years. And at the age of 9, she was healed in heaven from her bone cancer. But at that age, most of her treatment was at Children's Hospital of Philadelphia, or CHOP is what it's called. And I was in the hospital a lot with my sister, just in and out with all of her visits and hospitalizations and surgeries and everything. And the pediatric oncologists and pediatric surgeons, all of the pediatric staff that took care of my sister also took care of me and my family. So what I saw was a group of people that genuinely cared for us and cared for me. And I wanted to be that type of doctor. So I declared at the age of 7 that I want to be a doctor and I want to emulate these doctors who became role models to me. So that was my journey into medicine. I always thought I wanted to be an OBGYN. But when I did my third year of rotations as a medical student on OBGYN, I realized that that really was not the field that I wanted to do. And I was blessed in that I was at the top of my class in medical school, and that allowed me to kind of pivot into a field that is highly competitive because ear, nose, and throat surgery or otolaryngology is a very competitive field. So because of that, I was able to shift my focus. I spent some time and rotated with a Black ENT surgeon in Philadelphia. And after spending some time with him, it was done deal, sealed and delivered that ENT is the field that I wanted to go into. At the time, I did not know that it was less than 1% of Blacks in ENT, and it still remains that way. We are about less than 1% of Black ENT surgeons in the field. But that's really how I got into medicine was because of a tragic defining moment, in my life that put me in the track to be a doctor.
Right. And I was going to say too that I actually had someone on my show and she's a motivational speaker and she said that you find your passion, it's either the push of pain or
Right.
the pull of possibilities. So
Yep.
either the possibility of something there or the
Yep.
push of pain, but some kind of way,
Yeah.
unfortunately, your passion will be exposed if you
That's
follow.
true. I love that. And that's very true. And sometimes that push of pain can turn you down a different avenue. But for me, it was really that push in the back that was pushing me forward because I wanted to be that person in someone's life at a position that they really needed me. So I truly believe in being positioned in people's paths for a purpose. That really is like my mantra. So that's what I have always built my career as a surgeon. It's more than a career. It's my life's journey and my life's blessing to be a doctor and be that person for someone like those doctors were for me and my family at that time with my sister. Yeah.
That is so inspiring. So I have a sidebar on that. I also teach nursing as
Okay.
well. And
Mm-hmm.
so I had the most horrible nursing instructor for when
Mm.
I was going through nursing school. And I said I was going to go back and be a teacher. I was going
Mm-hmm.
to be a professor because I didn't want anybody to ever have
Have
that
this.
experience. So
Right?
yours was the positive,
Right? Yes.
kumbaya.
Yes.
Oh, and
Yeah.
mine was
Right.
let me be the change.
Right.
Either way.
Right. Exactly. Exactly. Yep. Yep.
So I love all of that, Dr. Former, and I love how you told all of that. Now, so you've been out here, you're healing people's nose, ears, and throats and everything. So at what point did you just decide to start recording videos and become Dr. Nose, the expert
Doctor knows best.
ENT?
Yep, doctor knows best. The funny thing is, it actually, my I have three children, and of course, like all preteens and teens, they're on TikTok and social media and all of that. And I was always that mom that was fussing, get off of TikTok, get off of that right now. You're wasting
and
time.
and look where the
Right.
oh how
All
the
the time I was fussing at my kids, right? Like, get off that mess. And my middle child, she was playing basketball at the time, but she overslept and she missed a game or something like that. And she woke up and she was very sad about it, felt like she let the team down, etc. So I'm just, as a parent does, trying to find something to make her happy, try to change her mindset to positivity. And I knew that, okay, they like TikTok, they like doing TikTok. So I went up to her room and was like, "Hey, Moni, let's make a TikTok together." And she's looking at me like, "Do what? Are you my mother?" You know? So-
I got one of them too. I got one
right.
of them too.
So she got up, she's like, "All right," and came downstairs and we're in the foyer, the front of our house with a tripod and making TikToks. And I was hooked. I'm like, "Oh my gosh, this is so much fun." So we were making silly TikToks with dances and stuff like that. Nothing educational whatsoever, just having fun. And the next video I made after all that fun was actually in the operating room at the end of my cases. And I did a TikTok about HPV, human papillomavirus, and just kind of something fun, educational, or whatever. And that video like took off, on TikTok. And I'm like, mind blown. Like, people really want to, what? And so I was super excited about it. And I'm like, wow, what a platform to be able to share what I love. And the other thing I love is advocating and teaching people how to be better advocates for themselves when it comes to their health and wellness. So it just took off from there, and I started making videos, just sharing different things from the health and wellness standpoint, really centered around ENT. That really has been my platform. I think I'm going to start to move out of other things, just other avenues of medicine, just overall health and wellness. But really, what I've been focusing on my platform is ear, nose, and throat related, issues, just because that's my wheelhouse. That's what I love. So,
Well, I definitely think that there is a need for that because, again, like you said, first of all, 1% of all Black doctors are in ENT, and
yeah,
surgeons are in
yeah,
ENT. So, you know that there's this huge niche for it.
right,
And then also, a lot of people don't think that it's a problem. They think
right.
that everything is allergies.
Hmm.
Everything is allergies.
Hmm.
So
Yeah,
it's like, You got something growing out of your neck. That is not
Right.
allergies. And
Right.
it's so funny you posted the video. I think like since I've been following you, you posted something about someone. I think they had a goiter or something,
Yes.
and I was laughing because my family always makes fun of me because I diagnose people all the time.
All
I'm
the
like,
time.
oh, no,
That's
I
just
don't
what we
know.
do. That's just what we do. I'm always looking at necks and noses. That's what I'm necks and noses. I'm always
So I
looking.
literally fell out because you were just like sipping your drink, and I was like, "Oh my gosh, I know!" And then it's the facial expression. Anyway, so you guys, first of all, make sure you go follow Doctor
Knows
Knows Best,
best. Yes.
Nose. Yes,
Right.
she has a great content. So to go into some of those things, let's talk about some of the disparities that we're talking about in the minority community, because as we kind of just lightly brushed upon, we were saying that there's so many things that are dismissed. It's, oh, it's allergies, go blow your nose, go take
Right.
a nap, go take an allergy pill. So give us a little bit of the insight from your standpoint about some of those disparities.
Right. So I think in my field, one of the biggest things I think about is head and neck cancers, and typically if you are a Black person, you really should be mindful about some of the signs and symptoms of head and neck cancer because oftentimes they can be dismissed, and it has been shown that people in the Black community tend to have their head and neck cancers diagnosed at a later time in the disease, and they tend to have more advanced type of disease, compared to the Caucasian counterpart. And we can look at so many different reasons to try to pinpoint that. But it really all boils down to health disparity. Is it access to health care? That can even be transportation issues, insurance coverage issues. It can be even access to getting into seeing the primary care physician, or that the primary care physician, and I don't want to blame it on primary care physicians, but that's usually where it starts, is you're going to see your primary care provider, and what the belief is, in your symptoms. Because traditionally, people in the Black community have not been believed about the severity of their pain. Sometimes it's believed that we don't feel pain as much as, say, the white counterpart. And there might be some of your followers or listeners who hear me say that and they're like, what? For real? And it is true. There have been studies that look at that disparity. Some in the health field think that, Black people have thicker skin than their white counterparts, so we don't feel pain as much, or, that you got to use a sharper needle or a bigger needle to stick us because our skin is thicker. All of these thoughts are so true. It's I'm not making these things up. So that's one of the health disparities that I often see in my practice, is with head and neck cancers. You can see that and the advancement of disease when there's presentation in Black people.
And I really love that you did say that, because every time I have someone that is a healthcare professional and we come on and we're talking about wellness, whether it be from sexual health to now ENT,
Yeah.
we cover all the ranges of it, and they always talk about being an advocate for your
Right.
healthcare, with basically being undermined, with things being pushed to the side, saying,
Mm-hmm.
not really having the knowledge of, hey, this
Right.
is pretty severe.
Right.
So I'm glad that you said that, because we try to reiterate that about being an advocate
Yeah.
for your own health care. Now, have you ever had, and we're gonna go in another question,
Sure.
you guys, I got my personal question. So so, have you ever had someone that's come to you and said that, like, man, I've been fighting this for, so many years, or I've gone to see several doctors and they all
Oh,
dismiss it. You're the first person. Oh,
absolutely.
okay. Don't even
Don't
finish the
even
question,
finish the
Holly. Let
question.
me tell you right now.
I mean, absolutely. I see that so commonly, Um, and for that, I don't even think there's a disparity. I see that in my white patients, I see it in my brown patients, my Black patients. Honestly, I just think it's in healthcare, period. And I don't know what the reason is, but I have patients that I advocate for, pick up the phone to call this person or that person to advocate for the patient because they just don't know what's going on, or they feel like they're not believed, with their symptoms. But that's one of the reasons why this platform that I have on social media is so important. You don't know how many DMs I get from people that say, hey, because of that reel you did, it let me know what questions to go ask my doctor, or I'll get people who will slide in my DMs and say, hey, I know you can't give medical advice, but I'm going to see my doctor for XYZ. And what questions do you think I should ask them? Or what should I be listening for? Or what should I expect? And that made me realize that my platform is bigger than I ever thought it could be, because I'll have those patients, I call them like patients. They're not even my patients. They'll come back and DM me and say, hey, I went and saw my doctor, and because you helped me with this, this, and this, guess what? I'm getting this done, or they're checking this, or they're checking that. So it's so vitally important that we all become advocates for ourselves. But sometimes it's hard to advocate for yourself when you don't even know what to advocate for, right? You don't even know what to ask for or what to do. So that's why my platform is extremely, extremely important to me. And I'm not one of those. You'll see some doctors are on social media, in their bios, no shade, no shade, no shade. It'll say, no medical advice. And yes, we have to say that because we can't give medical advice, on social media. And I don't give medical advice, but what I do say to people is I can help you understand what's going on, or help you understand what you should be asking for or looking out for, or know that this is good healthcare and this is bad healthcare. So that's where I come from with what I do, and why I, from that little TikTok with my middle child to turning it into Doctor Knows Best. That's where it came from.
Well, I'll be honest, Dr. Farmer, I do the same thing. My friends call me for medical advice all of the time, and I always close with,
Right,
but which to go follow up with your physician. Don't quote me on nothing.
right.
I don't know. I didn't see
Right.
it. I don't know.
Right. Exactly. Yeah, you can't give medical advice, but it's like we're all on this platform to share, to freely share
Hmm.
information. It's funny because that reel that I think you might be referencing, that I just did about, I was at a conference and a young lady was sitting next to me, and I looked over at her neck and I'm like, she's got a thyroid nodule. And I had one person commented and said, how dare you, like, tell this person something that's wrong with them, and why would you do that? That's invading their privacy and all of that. And I'm like, first, no, it's not, because wouldn't you want somebody to draw to your attention, like, that there's something wrong? Like, again, it goes back to my belief that I truly believe that I am purposefully positioned in people's lives for a purpose and for a reason. So I may have been positioned to sit next to her and to look at her neck and say, "Hey, has anyone ever told you blah 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 blah?" Right? So that's where it all comes from. It's no, I can't tell you this, and that. No, that's why I'm here. That's my purpose for it, is to help you.
Well, let me tell you, Dr. Former, if you sit next to me and you see something that don't look right, please tell me because I need to know. I'm going around life thinking I'm cute, and you're like,
With this thing hanging off your
really?
neck.
I don't want to be in your
Ah,
business, but girl, that looks crazy. Like, please, I give you permission. And
got
now,
it.
anyone listening, that if you ever sit next to me and you see something abnormal, I am not
Got
sensitive
it.
at all. Please let me know.
Right, right, exactly.
So the first question I wanted to ask you
Hmm.
when we're talking about medical right now. So one of the things that everyone is talking about is the throat cancer,
Yes,
and it's almost humorous sometimes when I see some of some of the, I guess, the ad libs
yeah,
or the uneducated people that are talking about it, and it's like now there's a huge link with throat cancer and oral
right.
sex. So can you go into that and explain how that actually pans out,
Right.
how is that defined? How do we find those things? What and also what they can do to protect
Sure,
themselves from that.
sure. So HPV or human papillomavirus has been found to be connected to throat cancer or oral pharyngeal cancer. And that's the area in the back of your throat, not so much the front of your mouth called the oral cavity, but in the back where your tonsils sit, the back part of your tongue, and even going up into behind your palate. This nasal pharynx, it's called. This is the area that I'm talking about that's more prone to develop a cancer from HPV. When I first started training and practicing, you didn't HPV wasn't a thing. Not that it wasn't a thing. Of course, we know HPV is a thing. It's been out there, but as far as its relationship to head and neck cancer, that's not was not a thing when I first started training. Smoking, drinking, smoking, drinking. Those were the one and two.
Till Michael till Michael
Hello.
Douglas came along.
Hello. Oh my gosh, I'm so glad you
Michael Douglas is
oh,
like, I got
I am
throat
so
cancer
glad you
from
said that.
oral
I'm
sex.
so glad you said that. But it was smoking and drinking. And smoking and drinking are still top, risk factors for head and neck cancer. But HPV is pushing up there and knocking out, smoking and drinking. But years ago, whenever that was, like early 2000, like it was a while ago when Michael Douglas came out and said he had throat cancer from oral sex, and people were in an uproar. But he was telling the truth. He was telling the truth that that's where it came from. But HPV and its relationship to oral pharyngeal cancer, it really is from oral sex. It's from oral sex, and that's how it is transmitted into the throat. We knew there had to be something else going on because we started seeing patients who weren't smokers, who weren't drinkers, and they were developing these cancers in the back of their throat. And it was like, where is this coming from? Like, where is it coming from? So there was a lot of research. We started looking at we even looked at could it be from reflux and the acid coming up in the throat causing the cancer? Could it even be from the metal in the old fillings in our teeth that is causing it, causing some genetic mutation in the tissues? All of these things, we started looking at in the field, but we realized that, okay, we know that HPV is related to cervical cancer. We know that there are other viruses like the Epstein-Barr virus or EBV that can be associated with cancers like lymphoma. Perhaps there's a virus connection. And lo and behold, testing those tissues, those throat cancers for HPV, we found that there was a subset of HPV that was related to these cancers, HPV 16 and HPV 18, with HPV 16 being the number one cause of oropharyngeal cancer. There's like 150 plus subtypes of HPV, but only a certain number that are thought to cause cancers, and HPV 16 is one of them for the throat. Here's an interesting fact, Holly, about HPV, right? The majority of us have been exposed to HPV, all right? If you have had sex, you have been exposed.
Listen, Dr. Farmer, when I had I'm telling you, my thought process, I was already about to be like, so what about the ones that's been fighting all their life, Dr. Farmer, and they've been out, they've been outside for a while now, like.
If you have had sex, you have been exposed to HPV. I mean, 85 to 90% of the population has been exposed to HPV, and you can have had an HPV infection and not even known it because the majority of us do not develop symptoms of an HPV infection. So you can carry it and not even know that you had it. But our immune system will fight that HPV infection and can eradicate it or get it out of our system within a few years. But there's going to be some, like those subsets of HPV, HPV 16, that can lay dormant in your body. It can stay in your body for years, years. You can have had a sexual encounter where you developed or contracted that HPV 16 infection that stayed dormant in your body. You never had any symptoms. And then 10, 15, 20, 30 years later, you can develop a cancer in the back of your throat for that. Okay. So
That sucks for the people that get it because you don't know who to
oh
blame.
my gosh, I did a reel one time and I didn't expect it to get,
You think it's who you with now,
I,
and it's somebody from
thank
high
you. I didn't
school.
expect it to get as much traction as it did, but it was a real simple reel where it looked like I was walking into an exam room And the music, I can't even remember what the sound was, but it was kind of like, I kind of backed out the room because it was like, after you tell your patient that their throat cancer is from HPV and their wife starts asking questions, backed out the room, right? But I've had that happen in real life where I tell a patient that their throat cancer is from HPV and the wife is looking like, who you been sleeping with? And it's like, nope, let's never did I think I would be having conversations with my patients about oral sex and about their sex life. But you do, and to have to inform them and educate them that no, this does not have anything to do with infidelity. This Your husband didn't have to cheat on you or anything like that. This could have happened 20, 25, 30 years ago when they were in high school, and they developed this now later. We're starting to see HPV throat cancer develop in young people. But the youngest patient I have was 38 years old when I diagnosed his throat cancer, young, and in my mind, I'm like, oh, this has got to be HPV, you know. But it can happen. And here's the thing though, also to not scare people, it's not very common, even though we're seeing a huge amount of HPV overall. The majority of head and neck cancers still are from smoking and drinking. And still, the majority of people who get HPV infections will get rid of it and eradicate it and not turn into a cancer. But we are starting to see a tremendous rise in head and neck cancer from HPV, which is transmitted from oral sex. And yes, men and women can get it. And yes, even if these are the questions I get, yes, even if you're not having sex now, you can still have an HPV infection and get throat cancer. Yes, even if you're in a monogamous relationship, you can still, because the person who is now in that monogamous relationship with you could have had lots of partners over here, as could you have. And the more partners you have had in a lifetime increases your risk of developing an HPV infection. So these are all facts, all
Hmm.
facts.
All right, so y'all be in them streets safely. If everybody going home for the
Right.
holidays, going reconnect with them old booze and stuff, y'all better stay safe.
Right.
Stay safe.
So you asked me, Holly, what are some things that you can do, right, to kind of protect
Hmm.
yourself?
Yeah, because it's too late now.
Once
We
you
done spent
There
our
you
life
go.
out here.
Right. Once you've started having sex. And are there some non-sexual ways that you can contract HPV? Yes, there are, but they're less common. Overwhelmingly it's oral sex, but yes, could a virgin who's never had any sexual encounters, and I'm not just talking intercourse, okay, I'm not just talking penetration, because you can still contract and transmit an HPV infection just from having oral sex. So, some people don't think oral sex is really sex, but it is, right?
I
So, it doesn't just have to be penetration, but you can be a straight out virgin, never did anything in your life, never had oral sex, nothing, and still be exposed to HPV in a non-sexual way. There are some ways of that happening, but it's very, very, very uncommon. Overwhelmingly, it is sexually transmitted. So, protection, right? Condoms, dental dams, but those are not 100%, just like they're not 100% to prevent pregnancy, right? Because the area around the sex organs can still be sources of you getting that infection. But dental dams and condoms can certainly help reduce the risk. Um, the HPV vaccination also has been shown. And I know I'm going to get the anti-vaxxers. I get it all the time when I talk about it, but it has been shown, studies have shown that the HPV vaccination has decreased the incidences of not only cervical cancer, but also head and neck cancer. And it's taken some time for us to prove that because, again, HPV and throat cancer is something that has really started to rise over the past 10 to 15 years. So the vaccination, and then, of course, don't have sex, right? Don't have sex,
well,
right?
I don't know about all of that, Dr. Farmer, but just like I just like I had the funniest meme, and then I'm gonna go into the next question. But I saw the funniest meme, and it was saying how people will have oral sex and then and with no protection and then put a condom on and they're like, well, you
Right.
already ate the
Right.
disease
Right.
now.
Exactly.
So same thing.
Exactly. It's still sex.
We gonna pray
Right.
for him, Dr.
Right.
Farm. We're gonna pray for him.
Right.
So, so you mentioned smoking and drinking several times whenever we were talking
Mhm.
about throat cancer. So that pretty much goes into the segue that I was thinking of, which was
Mhm.
about smoking. And the first question that I want to ask you about as an expert on this is, I know that now the trend
Mm.
is vaping. And people feel like vaping doesn't have the same. Oh, see, you already know where I'm going with it. And people think that vaping is safe because it's not smoking a cigarette. So, can you give us, or I guess, can you
Right.
educate us on vaping and some of those side effects that are unhealthy and the risks that we
Yeah.
have with
To
vaping?
me, whether if I ask somebody if they're smoking, it doesn't matter whether they're smoking cigarettes, cigars, vapes, you're still smoking, and even smokeless tobacco, or chew. Same thing. They're the same thing to me. And okay, don't get me started. It's gonna be an uproar. Smoking marijuana, same thing.
Mm,
Okay? Same thing. All right. But with the vape, I mean, you can still vape nicotine. It's still the nicotine in it that you can vape. And even if people are not vaping nicotine particularly, but maybe like a flavor, I've talked to some people because I've never vaped at all, but there can be
never.
flavorings that is actually in the vape. But some of the chemicals, some of that the chemicals that are in the vape, you're also inhaling those and the substances. You might remember there was a time period. I want to say that it was called Juul, the name of the vape contraption, or whatever. But there was a lot of controversy over that because it was causing people to have, we called it spongy lungs, holes in the lungs, where it was really eating away at the lungs. And it was one of the contaminants that was in the vape, you know? So it doesn't matter,
Mhm.
whether you're smoking cigarettes or whether you're vaping, it is still dangerous. It can still increase your risk of head and neck cancer. It still can increase your risk of having sinusitis and allergy and rhinitis or inflammation in the nose problems. It can still increase your risk of having asthma and lung disease. It does not matter. It's the same thing. You're still smoking.
Now, let me just ask you this because I do go out um, often, and unfortunately, because I really would rather be in my house in my pajamas, but I go and I don't. When I tell you, I
Hmm.
probably have a drink 2 or 3 times a year, like one drink, that's it. And I've never
Hmm.
smoked a cigarette before, so I don't smoke at all. But of course, when you're in the VIP section, here come the bottle girls, and the first thing they
Hookah.
bring out is the
Ah!
hookah. Okay, so so what I wanted to do was ask about that as well because I know that people they don't smoke at all, they don't vape, they don't do anything, but as soon as the hookah comes out,
Yeah.
here they are hitting it, blowing it, puffing it in my face, my
Yeah.
hair smells like it and it doesn't have the
Right.
smoky smell like the nicotine with cigarettes, but I definitely know if I smell like
Yeah.
smoke when I leave, I'm like,
It's
that's
not.
not healthy. Something is not going. So give us what exactly does hookah do to you, do to your lungs,
Right.
do all the nasal,
It's still,
orangeal
you're
cavity, like
still inhaling these fumes. You're still inhaling the smoke, which is
mhm,
dangerous to the mucous membranes or the lining. When I say mucous membranes, that's what lines your nose and your sinuses and your throat all the way down into your lungs, the mucous membrane surfaces. It's still causing irritation and inflammation of the mucous membranes, which can increase your risk of developing infections, swelling and breathing issues. I'm sitting on a reel right now that I was putting together. I don't know if you saw this circulating TikTok, but there was a TikTok that some young ladies, it was about 4 or 5 friends, and they ended up in the emergency room because they were smoking hookah. And they were in her apartment, and
mm,
it was, again, I'm not versed in hookah and what you use, but it was these orange, they call them orange something, but they look like round disc or something, and that you put on top of the hookah and you're smoking it, right? But they were in her
mhm,
apartment. They had the windows, they had the exhaust system on and all of that, but then it got cold. So they closed the windows, they turned the fan off and the air purifiers and stuff. And all of a sudden, one of them started to get a headache, And I looked at all the different TikToks that they put up that they were explaining this. One started to get a headache, then another one got a headache. Then, thank God, the young lady had a carbon monoxide monitor in her apartment. The carbon monoxide monitor went off. They basically got carbon monoxide poisoning, from smoking hookah. So they ended up in the emergency room having to get oxygen, and they almost died, because of it. So there are dangers. I know it's fun. You don't want to be that Debbie Downer. I know it's fun and all of that, but there
I
but
know.
there really
I'm
are
like,
health.
you know how
Yeah.
hard it is to
I,
stay young and fine? Like, I don't want nothing slowing my metabolism down. I don't need no
right.
smoke. Like, it's hard enough already. I don't need no
Right. There
extra
really are
stuff.
health, deficits. There really are really negative health effects coming from, smoking hookah. And don't even get me on secondhand exposure, because you don't have to be smoking it yourself. Not only, hookah, but cigarette smoke, and vape. You're being exposed to all of that as secondhand. You might as well be smoking it yourself, So when I ask people in my practice, do you smoke? And they say no. And then I say, well, do you live with a smoker, or are you exposed to secondhand smoke? And they say yes. And I'm like, okay, you smoke. I mean, literally, it's like you smoke, and you're still going to have those negative effects to it. And your risk of developing cancer is you're still at a higher risk than someone who doesn't smoke. So,
And one of the things I'm so happy that they banned
mm-hmm.
smoking in clubs, because one of the things I remember, and I'm going to age myself, I don't know when they banned smoking in clubs, but one of the things I used to hate, especially because I'm from Louisiana, and so Louisiana is so at the bottom, which is why when everything for Louisiana, they're always like number 50 on everything good, they're at the bottom,
Oh
everything bad,
gosh.
they're at the top. So I grew up, and so they had the smoke, and I remember going home and I would have to wash
Yes.
my hair like
Yeah.
2 or 3 days, and I still smell like smoke. So I would always say, if that's my
Imagine.
hair, imagine what that does to
Right.
your
Right.
insides. This was just me in the club absorbing it. Imagine how it is. But of course, people start drinking,
Right.
Mardi Gras, whatever. Now you're a social
Mm-hmm.
smoker
Mm-hmm.
and stuff like that. So I'm glad that you did bring that up and say, even if you're not the one smoking,
You're
you're
still
still
exposed to it. And
smoking.
that's why I made that real, what I say to parents, when they tell me they smoke outside, and I tell them smoke naked because and then when you go in, take a shower and wash your hair, because it is on your person, and that
Yes.
gets transferred to their children. So I see the children that are suffering with ear infections and sore
Mhm.
throats and upper respiratory and sinus infections and breathing difficulties because they live in a smoking household. Even if their parents smoke outside, they're still exposed to it. Yeah.
Yeah, so stop being selfish. Stop being selfish. There you go. Give it up.
Right.
Just stop smoking altogether. So,
Yeah.
Dr. Former, I just wanted to ask one more question, because I know that one of the things that I did think was interesting, and because we've talked about nose, throat, and I wanted to
Yes.
just touch on ear, as you are an ENT. So one of the things, especially for younger kids, I think parents maybe
Hmm.
don't know how to clean their
Hmm.
ears adequately. And then also older adults, man, when I was a floor nurse and I
Yeah.
had to do anything where I had to stick a otoscope in the
Uh-huh.
the the
Wax.
ear, and I would
Hmm.
see all that black, I would be like, "Ugh, ugh." So so I would be like,
But your
I don't want to
ears.
touch your feet, and I don't want to touch your ears. Like, leave me alone. Anything else,
Right.
I'm your girl, but boy,
Right.
do not give me feet and ears. So what can we do to prevent earwax? What's the proper way of
Hmm.
cleaning our ears? And then do you have any suggestion for anyone that maybe doesn't know
Yeah.
how to clean their ears, or their parents or the
Absolutely.
kids or
So,
whatever?
I mean,
Mm-hmm.
earwax, of course, is very common. There's benefits to earwax. So, I don't look at earwax in a negative way, whereas some other people usually do. Anytime I post something about earwax and show it, people are like, ew, disgusting. Oh my God. you know, but there's benefits to earwax, but it can build up because the earwax is in a small canal, the external ear canal. And some
Mhm.
people make more wax than other people. It's just like some people have oily skin, some people have dry skin, same thing in the ear. Just remember, the number one thing I want people to remember is that your ears naturally clean themselves. So it's like a self-cleaning oven, right? The wax is pushed to the outer part of the ear and it cleans itself and pushes it out. There are certain reasons why you might get wax buildup though, and it's not so easy for your ear to clean itself. Like if you have dry skin, then the wax is going to be dry and it will get more impacted. Kids, you might see it more in, like you talked about, because their ear canals are narrower and they're smaller, so it's easier to get impacted. Some people have a wavy or curvy type of shaped ear canal, so of course the wax is going to be harder to get out. In older people, it's not only dry skin, but as we get older, we get hairy ears, right? So we get a lot of hair in our ears,
Mhm.
and so the wax gets caught, in all of that hair. But you can at home use wax softening drops. They have brands that are over the counter, like Deep Rocks. You can even use a mild peroxide, like 3% peroxide, and put 1 or 2 drops in the ear to help loosen it up. Olive oil, vitamin E. One of the things I tell people is take a vitamin E capsule, the gel caps, and stick a pin in it, and you can squeeze a drop or two of oil in the ear canal and just kind of massage it down, and that will help kind of loosen and moisturize the wax so it's easier to get out. You can flush the ear. They have flush
Mhm.
kits, ear flushing kits over the counter that you can purchase where you're flushing it with a solution to help loosen it and flush it out of the ear canal. That's safe to do if you don't have a tube in your ear or you don't have a perforation or hole in your ear. So you need to make sure that you don't have one of those two things before you want to flush your ear out, or that there's not an acute infection
Mhm.
also. And then if it just really gets impacted, everything you do is not helping, then you need to go see your primary care physician or an ENT doctor like myself, and we can physically remove it with instruments. In my office, we use a microscope and instruments under the microscope to go in and physically clean the wax out of the ears. I have patients who come in like every 2 months or every 3 months simply just to get their ears, clean, just to get the wax out of their ears. And you don't want to use things like Q-tips the Q-tips will push the wax down. Now, let me just say this. I don't mind you using Q-tips if you're only, once the wax gets to the outer of the ear right here and you see it and you just want to use that Q-tip to gently wipe it away, but you don't want to take that Q-tip and push it in and then you do this thing. Nope. I always know
I take
up
I
here,
take the
yeah,
Q-tip, I
all the
start up here, I
crevices.
go in all
Yes, you
all of
can
these
do that.
crevices.
Absolutely. You just don't want to put it in the opening and then push it in and do that twisty motion. Because all you're doing, even though
Right.
you're bringing some wax
Mhm.
out and it's stained on the Q-tip, you really just push the wax further down, in your ear. And people who use
Mhm.
earbuds, people who have hearing aids in, they're going to be more prone to getting wax buildup too, just because you're putting a plug there essentially. So you're not allowing your ear to naturally clean itself. You're kind of hindering that. Okay, are you an ear buddy? As I got an earbud in my ear.
I'm I'm a
Yeah,
I'm a
yep, yep,
AirPod
yep.
girl.
So you just got to give your ears a break and let them clean themselves. Yeah, yep.
Okay, I'm gonna work on that, Dr.
I
Farmer.
have
I'm
people
gonna
who
work
tell me I
on
don't
it.
use Q-tips, but I use a bobby pin. I'm like, okay, girl, listen, that's the same thing.
No, no, that ain't me. I would be scared. A
Right.
bobby pin is
I've
sharp.
heard it all
Shoot,
of what's being used to clean their ears out. Oh my gosh, and I have to say this. I can't let you go without saying this. Do not use ear candles. No ear candles. Okay? You've heard of ear
Ooh.
candles. You do not want to use ear candles. They do not work.
Mhm.
They do
I've
not
seen
work
some
to clean
videos
wax
about
out of
that.
the ears. I
Ooh,
don't care what
okay.
you tell me. They do not work. So do not use ear candles. They're more dangerous than
Oh, they
anything.
look.
Don't do it.
Mm. Oh, since you just said that about stuff on the internet and going viral, Have you ever saw like a
Hmm.
bug? Because I've seen a video where a
Yeah.
spider was in there, a
Yeah,
roach
and
was
I've
in there.
I've
Ooh,
had to. I mean, one of the deterrents to bugs going in the ear is wax. So just remember that. So if you're one that is you prefer to have no wax in your ear, I don't want no wax in my ear. Well, one of the deterrents to bugs is wax, because of the consistency, what it's made of.
where are we that
Anywhere,
bugs are in
anywhere.
our
And it don't
ears,
even it
Dr.
don't even
Farmer?
have to do with your living condition. It don't have to do with, oh, they're dirty. No, bugs are everywhere. Shoot, we sleep with bugs every single night. We do. But they can crawl, they
I'm sleeping with earmuffs.
you're gonna make me fall out the chair.
I thought you were about to debunk the
No,
myth.
they
Like now
bugs
you made it
they
worse.
can
Now you
crawl down in your
solidified it.
ears. Of course, if you're in an environment like you go camping outside or something like that, you're going to be more prone to get a
Mhm.
bug get in your ear. But can it just happen if you're in your room? I mean, it is. It's possible that you can have a bug crawl in your ear. But yes, I've had patients where I've had to get bugs out of their ears, and I hate it. It gives me the EBGBs. There's just certain things, but to see these legs and but yeah, it can happen and you got to
And
get it out. I just
eyes,
got to suck it up and
you
get it out.
and you have to
Right.
be the
Right.
professional and
While
make me
I'm
feel
while
like
I'm
nothing is
behind the
wrong with
I'm
me too.
behind the
So you have to be
microscope
with
going
a straight face.
Yeah.
Oh my God, that part, that part. Okay,
Yes.
so last question, Dr. Farmer. I know that you
Yeah.
are also an entrepreneur and that you also have other business ventures because I told y'all she got she 80 jobs. Like she's doing all kinds of stuff. So, for people that are following you, that are interested in you, just tell us
Yes.
about the
So,
entrepreneurial Dr.
in
Farmer
addition
as
to
well.
owning, co-owning, I have a partner in my practice and an outpatient surgery center as well. I have an e-commerce business called Salt Me, and that really started out of necessity for my patients. I was seeing a lot of patients who were coming in really dependent on nasal decongestant sprays like neosynephrine and phenylephrine, which those are over-the-counter decongestant sprays that are just not healthy to use on a daily basis. So I was trying to find something that was more natural that could help my patients. Where I live in the Midwest, I see a lot of patients who want more natural type of remedies instead of just writing a prescription for something. So I started doing research into the essential oils. I hired a professional aromatherapist as well. And after doing some research with her, I looked at 7 different essential oils that I felt were wonderful for upper respiratory, breathing, and nasal and sinus relief. And I put those essential oils into a nasal aroma inhaler. And unlike other inhalers, which are made with a little cotton swab inside of it that you drop the essential oil on, mine is different in that I use Himalayan salt and I infuse the essential oil into the Himalayan sea salt and create a natural inhaler that way. So it's used much like a quote unquote Vicks inhaler, but it's an all natural with 7 essential oils for adults, 6 essential oils for kids, and then 6 essential oils for women who are pregnant or nursing. Because what I learned in my studies with aromatherapy is that not all essential oils are safe for children, and not all essential oils are safe for women who are pregnant or nursing. So I have 3 different of those nasal aroma inhalers for that population of people. And my company, Salt Me. You can follow me on Instagram for that. It's actually Salt Me Pink. So Salt Me like me, Me, and then Pink on Instagram. And that's my website also, saltmepink.com. You can go and check out those inhalers, but they're absolute wonderful. You can use them throughout the day. They're not addicting at all because they're non-medicated. It's natural aromatherapy and essential oils. So yeah, that's how Salt Me started. So
I'm
yeah,
gonna have
that's how it
Yes, I'm gonna
started.
have to check it out. I'm gonna have to check it out. I'm trying to be this holistic Holly going and yeah. So every time I have a guest, I'm like, nah,
Yeah,
you know what? I might add.
yeah,
I might
yeah.
add a date. I might
Well,
add a
while you're
this. I
at
might
it,
add
add
a you know.
saltwater rinses to
So
your regimen as well.
that's what I was
Yeah.
like. Now I'm gonna have to. Yeah, now I'm gonna have to
Add
add a
add
a
add my
salt
add
pink,
Salt Me Pink
pink
nasal
salt.
inhaler, and Yeah, add Salt Me nasal
Salt me pink.
inhaler and saline rinses. The Navage machine is amazing. That's my favorite. But flushing your sinuses with saline is a preventative, natural thing to do to help prevent upper respiratory infections. So add that, Holly. Add that too.
Especially I'm on it. I'm on it,
Right.
especially with cold and flu season because you know
Exactly.
everybody about to be
Exactly.
coughing on us and sneezing. So, Dr. Farmer, go ahead and drop all of your social media tags, your website, where people can follow you, how we can like and
Okay, I can put that
subscribe
in
to
the chat.
all of
Is
your
that what you
stuff.
mean? Oh, okay.
Well, no,
Okay.
say it because I'm going to do audio. So
Right
somebody
now,
is running
yes,
on the
yes.
treadmill right now
Okay.
listening to our show.
Okay.
Yes, and then they can look. I'll
Okay.
have it
So you
typed
can
out in the
find me on
podcast
Instagram
notes.
and TikTok at Dr. Knows Best. That's DR Nose Best. Dr. Knows Best. I'm on Instagram and TikTok. You can find me on Facebook also as Tonia L Farmer, MD. That's Tonia L as in Lorraine, my middle name, Farmer, MD. So that's where you can find me. And my website for my e-commerce business is www.saltmepink.com. Yep.
All right, I love it. Yes, and I will have, as
Awesome.
always, clickable links for the ones that don't listen. Or
Oh,
forget how to spell, because that's the only bad thing
right,
about the
right.
difference between the ones watching the video, and because they watch like a 3 or 4
Hmm.
minute clip where I take everything from what we said and I try to condense it
Right,
into like 4 minutes long and take all the pertinent
right.
stuff, and then they're like, "Where is it?" And I'm like, "It's on the podcast notes, like, pay attention." So, thank you so much, Dr. Former, for one, sharing your story, and two, inspiring other people
Yeah.
to follow their passions, showing us, even little girls right now that are here and they're trying to figure out what they can do and what their path is. I mean, you're also laying that foundation for other people to follow and make that
Yes.
1%
And higher, and
2%.
higher. We need it. We need it.
Right, 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 right. So thank
Thank
you
you
so
so
much,
much for
Dr.
having me.
Former,
It was
for
an
your
honor.
story.
Thank you very much, Holly.